Well, good afternoon, everyone. Good afternoon. It's so nice to see so many people here on such a beautiful Florida day. It's the kind of day that is really represents the reason why we've all moved here. Right? Yes, sir. Oh, okay. All right. So you didn't move here for the weather. You moved to follow your wife. You moved for the weather. Okay. Happy wife, happy life. Remember that. Okay. Yes. Okay. So what I'm going to do is this is the topic of our conversation today. Have you gotten this Medicare guide in the mail? Okay. And have you read it? And you glance through it. Okay. So, I read something in, I guess it was AARP that said, the government sends out all of these publications every year, and the majority of the people don't read them. Okay, so I would expect that in years to come, what's going to happen is that this will all be electronically available to everyone. So today we're going to go through this book, essentially summarize what it says. And what I would like to do is I would like to introduce our panel. And we have Debbie Kennedy. You all know Debbie? She's our accounting director. And today we have B. Scafaldi with us. And B is from Shine, the Office on Aging is her employer, and she is an insurance expert. I had the opportunity to meet with her before this to find out a little bit about her information, and it's really vast. And then we have Michelle Davidson. Michelle is our admissions director at Water's Edge. And last but not least is Erin Montague, our administrator for Water's Edge. So before we start, I'd like to ask Maria to come up for a moment. And she'll give you a little background as to how this whole process started.
First of all, I want to thank everybody for being here and also the panel for taking time away to inform us. We're all getting I don't know if anybody else is being bombarded with TV commercials, mailings, and phone calls. The Healthcare Committee, it came up in our committee that we were concerned about people making wrong decisions based on bad information, and they needed to have the right information about what really works when you live here at Sand Hill Cove. So in conjunction with Mary, we approached Mary to see how she would feel about putting together something. And so in collaboration with Mary's office, and I think most of the people here were involved also in the planning, we developed last year's program. And it was such a success that Mary decided to do it again this year. So
Thank you very much, Maria. Really appreciate that. Debbie went to quiet down the staff in the kitchen, okay, so that they don't interfere with our seminar. So I'd like to turn it over to Debbie at this time because she's going to be talking about standard Medicare, and she's going to be talking about what the contract with Sand Hill Cove states. Debbie.
Good afternoon. The reason I'm particularly familiar with this is because I do the Medicare billing for Water's Edge, even for inpatient and outpatient. So I deal with this a lot. I deal with the plans. I deal with collections. I deal with not able to collect. So I just want to talk about it. So we're going to talk about standard Medicare and supplement, which is called Medigap. We're going to review the contract that you have with Water's Edge and the financial responsibility if you have an Advantage plan. So we all know, or I think we all know, that there's Medicare Part A and B, which is what we call standard Medicare. And typically you then have a supplement with that that covers the coinsurance and the copays. Now, if you don't have standard Medicare A or B, then you've got what they call Medicare C, which is either an HMO or a PPO plan. Okay, so and most people don't have that. Most people have the standard Medicare, but some do have, like Aetna or United Healthcare or Humana plans. And then, of course, Part D is a prescription drug that you're all aware of. And sometimes in Part C, that includes the prescription drugs. Then on the supplemental plans, you'll see all these letters up there. You pick a plan when you have a supplemental, and all the plans based on these letters are all the same. So for example, F was like the most popular plan that covered the very most. But now for someone like me who's getting ready to start with Medicare and a supplemental, it's no longer offered. The one I can take is G, is as closest that I can do. So those are the richest plans that you can get. And you can see, like, for example, A doesn't cover skilled nursing. So if you have Plan A and you go to Water's Edge and you're on your 21st day, you're going to have that $200 a day copay because your plan, your supplemental does not have skilled nursing. So it's very important when you get these to pay attention to what's going to be covered on your supplemental plan. Okay. So a majority of the contracts, the older contracts, the residents who've been around the longest, they were required to have standard Medicare A and B and a supplement. Now, some of our contracts have changed and it says or an equivalent that is acceptable and able to completely cover a Medicare qualifying stay. So if you get a managed care plan, we're not, and it says up there, I think, United Healthcare, and I don't believe we have no plans at all at this time that we are qualified or that we participate with. So that means we have to try and negotiate a rate with them. We don't get the standard rate that Medicare would pay. They may offer us where we would get paid by Medicare $600. They may try to give us $300 a day to cover the stay. So it's very complicated and hard to collect from the managed care plans. But we will try to do that. But what is going to happen is if you've got the managed care plan or the advantage plan, we will try to negotiate a rate. But if we cannot negotiate the rate, the Medicare rate, then that difference is going to be your responsibility. Or the other option is to go to someone else who does participate with your plan and have your stay with them at the other facility. So it's huge if you can stick with your standard Medicare A and B and not go to a managed care or a PPO plan. Anyone have questions on that about the Water's Edge piece? Sure. Okay. So he still has his group plan. So then the group plan, it pays his primary and Medicare pays his secondary. Yeah. So, and supplemental, correct.
But the idea is that the supplemental is now the primary, okay? So it would have to be investigated to see if the primary insurance covers skilled nursing care. Okay, so that would be, what is the primary insurance? United Health. Okay, so that's the primary. What, dear? Okay, because the United Health that they have is probably a benefit of his retirement that the whole company has United Health as their insurance coverage. So the question would be, we would have to really take a look at that because Waters Edge, and correct me if I'm wrong, does not have a contract with United Healthcare for skilled nursing care. Okay, so that would be really an outlier. Okay, and his Medicare A just probably only has Medicare A, right? And okay, because that plan that he has is his primary and Medicare is secondary. That was like me, okay, when I worked, I work for Sand Hill Cove, and last year I was covered by Sand Hill Cove's insurance plan, okay, and I had Medicare Part A. Everybody is eligible for Medicare Part A. I never used my Medicare Part A. That was irrelevant, okay, and my insurance with Sand Hill Cove was my primary. Okay. So, and that was, it wasn't, so when I decided that I was not going to be continuing to use the PPO because it limited what I could do, I decided to go for standard Medicare, a secondary insurance, and a Part D because, in my opinion, that was a much more flexible plan. It gave me more choice for my health care. Okay.
Yeah, that is the really important part. I mean, we do our very best to try to negotiate with the insurance, but have found many times it takes 4 months or longer for them to pay. Medicare pays in after I submit the claim. Often they want medical records and then they take money back from us. It's really, really hard for any of the Advantage or the PPO plans. It's very difficult to work with.
Oh, we have a question. Yes. No, not yet. We're not open for questions yet. Barbara? Yes, and we're actually going to hold the questions to the end so that we can keep within our space. And yes, we have an extra microphone, so we'll be working with that. Next, I'd like to introduce you to Michelle. Michelle, pick up the mic. Turn it on. Michelle does all of the admissions and insurance checking for Waters Edge. So she can talk to us about the difference between standard Medicare and the Advantage plans.
Okay. Hello, everybody. So for the standard Medicare, like Debbie was saying, you have Part A coverage for skilled nursing, and those first 20 days would be covered by your Medicare. So if you were in the hospital, you had a 3-night stay, and you came to us, and you were not with us or another facility like us, in the past 60 days where you used any of those days, those first 20 days would be covered 100% by your Medicare. If you need more than 20 days, that's when you're going to have the copay, and that's for up to 100 days. So that's where your supplemental insurance will come in play. And I just talked about the qualifying stay also. So you do have to have a 3-night qualifying stay at the hospital for your Medicare to cover your stay at Waters Edge. Your Part B coverage at Waters Edge would be for things like if you come to therapy, outpatient therapy. Let's say you live at Waters Edge permanently and we noticed you had a decline and we needed to give you some therapy services. That's where we would also bill your Part B coverage.
Michelle, what happens if they have an HMO and they need to have therapy or skilled care? How's that work for you?
Okay, so that's where we're going to come up right now, the Medicare Advantage plans. First thing we have to do, you're at the hospital, you have one of those Medicare plans, we have to call and get approval for you to even come to us. So you may have to sit at the hospital for a day or two while that's happening. extra till they say that they'll cover you. Once you come in, prior to that, I have to send them a bunch of medical paperwork that they will review to see if they'll approve for you to come in. Once we get the approval, you come in, then we would, every few days, it usually runs 3 to 5 days, they want us to keep sending more clinicals to prove that you need our services. They make the decision when you're going to be discharged. It's very driven by that insurance company. We don't really have control over that. We make our recommendations, but agree with it. And that's another process that we would go over with you at Water's Edge if you needed to appeal. So because we do not participate in any of the companies, because we're not able to get contracts with them at this moment, we've been trying, you could have, like Debbie was saying, an out-of-pocket responsibility. So if the negotiable rate, they say, we'll give you 300 a day, but it's really costing us 600 a day to take care of you between your therapy services, room and board, and things like that, you could be responsible for the balance. Oh, any questions real quick for me? And if you do happen to have a Medicare replacement plan and you want to come over and see me, that we can call the insurance company to kind of see what they may somewhat of a percentage cover for you. I'm more than happy to run that for you. Please come by. Thank you.
You know, Michelle, one of the things that Debbie said that I was really surprised to hear was that in dealing with Advantage plans, there's been a take back of money. Now, y'all have to sit here and realize that water case. So if we're in a position where we're taking in people to care for, and they're reimbursing $300 a day, and it's costing us $600 a day, that doesn't make a lot of fiscal sense. It doesn't make a lot of fiscal sense to have money taken away, because again, that hits the bottom line. And I know that, you know, there's a lot of pressure on Water's Edge to build census. And one of the disqualifying issues that Michelle deals with on a daily basis in referrals from the hospital is the number of Advantage plans that are out there. So it's not in Water's Edge best interest financially to take in someone who is a non-Sand Hill Cove resident for rehab care if we're going to be reimbursed only 50% of what that cost is. There was an article, who gets the AARP in here? Anybody? Yeah, okay, Ty actually brought that to my attention. And there's a whole discussion about Medicare, you know, what it pays for, where it's going, what's going on with the Advantage plans. And roughly 30% of retirement age people at this point are enrolled in an Advantage plan. And I'm going to turn this over to B from Shine, because she's most knowledgeable. And she really gave me some really good information that I wasn't aware of. Okay. Kyle, we need the presentation on.
Get stuck in the hospital, let's say, during all this.
Nobody can hear you out there.
I'm sorry. For those people with the Advantage plan that get stuck in the hospital because they have to go through all of this paperwork, or if they decide, because the hospital's not going to keep writing stuff to keep them, that's an issue, so they have to leave. Now they've been put in the position of having to come to Sand Hill. You're billing them, the resident or the patient. Is there the Advantage plans, will they reimburse the patient? Is there a reimbursement if whomever goes in?
Yeah, I really couldn't tell you honestly. I just know that if we'll take our Sand Hill Cove residents, not to have you guys sit there for 2-3 days, but you are under the understanding that if it is denied, you're lucky to have those Sand Hill Cove days that you can fall back on, and then just, you know, those 90 healthcare days, you can fall back on that for room and board if you were denied. but somebody outside does not have that. And then sometimes, like Mary was saying, it's not financially smart for us, then we're could never get the money. And then Debbie's going to have to try to collect and, doesn't mean they're going to pay us.
Understand though, when we're saying it's not financially smart, a Sand Hill Cove person, we will never deny just because you have an Advantage plan. You are our residents. We will always take care of you, whether your plan is financially smart for us or not. That's part of the agreement of taking you in. I guess what we want to make sure you're aware of is that you may have some additional costs because of that plan if it doesn't fully cover what we need it to cover.
Thank you. Now, I have an expert back here on Advantage plans who, and then B is the lady.
Hi, thank you, Mary, for allowing me to come. This is open enrollment is right now, right? October 15th through December 8th, right? So we're all making our choices, right? This is Shine. Shine is a member of the Department of Elder Affairs, right? Our vision is for all Floridians to live well and age well. Our Shine mission, Shine stands for Serving the Health Insurance Needs of the Elders, by the way. Everything in the government has an acronym. We provide free and unbiased healthcare counseling through dedicated network of volunteers empowering Florida seniors to make informed healthcare choices, right? So we have counselors, and usually them are, people of your age that have really great healthcare knowledge and just like to share their experience. And it's done through phone calls or one-on-one counseling services. So Shine, I have to put my disclaimer up there, is a free program offered by the Florida Department of Elder Affairs in partnership with your local Aging Disability Resource Center, right? We're managed by the state of Florida. We're free, unbiased, and confidential. So we're number 9 here, PSA 9, Palm Beach, Treasure Coast, Martin, St. Lucie, and Indian River, and Okeechobee. Oh, I'm sorry. I'm from New York. I always talk fast. Originally, been here 40 years though. Shine counselors. Okay, Shine counselors, like I said, they're really wonderful people that just really want to help the fellow citizens. So they do all kinds of things. The Shine counselors. They help with original Medicare. You call them, they decide, you tell them what your need is, and they'll help you decide what's best for you. They do Advantage plans, they do. Prescription drug. They help you decide which prescription drug coverage. If you go in Medicare.gov, you can put all your scripts in there, and then you can decide on what Part D plan is best for you. It's really up to date this year too. Medigap, they also can help, like Debbie was just talking, the A through G and F, and they can determine what Medigap plan is best for you. There's extra help for people with eligibility and low-income housing, and we do with Medicare claims and appeal, fraud and abuse. If you feel you're a victim of fraud or abuse, our Shine counselors can help you with that. Open enrollment, right? That's what we're here for, right? We want to decide. So October 15th to December 7th, and changes are effective January 1st, and Shine can help you. You got your notice, send right? Your annual notice of change. That's where you make your choices or to stick with what you got. Begins October 1st. So I want to talk about this beginning October 1st, right? So I did some research myself and I decided, what is all this about? And now I'm getting the same calls you're getting, right? We're getting all those calls. So it just came out, SMP is Senior Medicare Patrol. And they put out this big thing about what Medicare Advantage plans can do and cannot do. Okay, so I'm just going to say some of these for you. What violations? And our violations, we report them to the OIG, the Office of Attorney General. If you're violating, I can do that. I had a man I did a research healthcare with, and he was so crazy, and he was giving away umbrellas, but he needed your name, and that's against the law, right? If he's giving you a free thing and taking your name, he can't be doing that. An agent or broker representing themselves as though they come here sent from Medicare, Social Security, or Medicaid. They cannot represent themselves as a Medicare, right? They can't say, I'm calling for Medicare. You cannot receive unsolicited home visit. They can't come knock on your door. Receiving information such as leaflets, flyers, door hangers on your car or at your residence from a company with whom you did not have an appointment. They cannot go around and put these things on your cars, up on your windshield. And like if you're at, I don't know, Publix or something, right? You can't, they're not allowed to do that. An agent initiate discussion about insurance products during a visit or meeting about a Part D plan. They can't be talking to you. If they're talking to you about Part D, they can't go back and talk to you about the other things. An agent returning uninvited to a resident after missing an early appointment. They can't come back not having an appointment with you. Marketing events that are later called without permission. So if you go to, I don't have dinner or lunch somewhere and they're talking about part whatever, Humana, United, and then they call you later, that's not allowed. They're not allowed to solicit you. An agent signing a beneficiary up for a plan that's supposed to cover specific prescriptions or services, but the beneficiary learning later that those prescriptions or services are not actually covered by the plan. So it's false advertisement, right? Recently, though, the Senior Medicare Patrol had lots of calls, and we get calls all the time telling what's going on. And they got people, as soon as they call you up, hey, Mary, it's Bob. He says, your name Mary? And they say, yeah. You say yes, they got you. You said yes. Hey, Mary, is this Mary? Yes, it is. They got you. You signed up for whatever they're signing you up for. So be careful about saying yes when somebody asks you your name. Hey, is this Debbie? See, they got you. Hi, is this Mary?
Who's calling?
That's what you say. That's what you say. Who's calling? Who is calling? So they can't conduct marketing or sales. They can't be here selling you something, right? Sell door to door. They can approach you in a common area. They can't be sitting outside Publix and approaching you. Hey, look what I'm selling here. Offer health screenings or activities that perceived as or used for cherry picking, right? They're saying, oh, yeah, I'll give you a free test over here if you sign up, right? So just to let you know, the Senior Medicare Patrol can help you with that, or call the OIG. Right? Medicare, we know that. To pass for Medicare. I wanted to get really to open enrollment. So understand credible coverage, right? Day-to-day credit can shorten the pre-existing condition waiting period under the Medigap plan. RX changes, right? Your Part D plan. Are my drugs covered? That's what I said. You go in Medicare.gov, you put all your scripts in there. I put lisinopril 20, Eliquis this, and it tells you how much and comparison costs your Part D plan. You can get the best plan for you. Right? You can call that finding a penalty may apply. So if you don't sign up for your Part B and your Part D when you sign up for your Part A, or you sign up for your Part D maybe after you retire or you stop working, there's a special enrollment period that you can still do that, 6 months. Just to let you know, you can switch. Oops, going back. If you decide, hey, I signed up for the Advantage plan, I really don't like it. There is a, oops, I made a mistake time. January 1 to January 31st, you can switch right back. Okay, so oops, I made a mistake. I want to go back to my straight Medicare. I didn't like that plan. My doctor wasn't there. They wouldn't let me go to the right therapy. All these things that they manage when you're in that HMO plan, right? Or HMO or PPO plan. You can't go to Water's Edge for your therapy, your skilled nursing facility, right? It's just trouble. I've done a lot of skilled nursing, and those managed cares play a lot less, and it's just you can't get the therapy that you need when you're using those plans. So this is the Medigap, right? Switch Advantage plan, switch Medigap. We want you to care. We want you to, look at those costs. Let's see. So RX, I want the drug one. Selecting Medicare coverage, right? Disenrolling. Really, we want you to call Shine. Shine can help you do that, right? We can help you choose the correct Medicare Part D plan. We can help you, your drug plan. We can help you choose the correct Medigap plan. fraud and abuse. Just quickly for fraud and abuse. Medicare abuse is the payment for items or services that are billed by mistake, right? Should be not paid by Medicare. Fraud is purposely billing. So this is intent, right? They didn't mean to do it. And it happens. I had a member that had a very common name and he got billed a bunch of stuff that wasn't for him. The bad thing is that now that man has all kinds of other diagnoses he didn't have, right? Now he's got all these things he didn't have. And so you got to be careful with that. Especially, you get that walker that you didn't need. And then when you do need the walker, oh, I'm sorry, you already got one, right? Prevention, right? We want you to prevent, detect, and report. We want you to prevent Medicare fraud. $60 billion a year is wasted on Medicare fraud and abuse. That's what I said, $60 billion. We want you to treat your Medicare card like a Social Security, like your credit card. Don't carry it around. Don't give it out. Don't let people have it. So here's some tips. Like I said, treat it like your credit card, right? Only trust it to people that need it. Do not give it out. I had a member call the other day, and all of a sudden he's telling me his name, his social security number, and everything. I don't need all that. I don't need all that. I just need your name, okay? I don't need all that information. Don't rely on advice of strangers who call, visit, or approach you in public. Like I said, do not give people all this stuff that they don't need to have. Never sign a blank medical insurance form. So we know that Medicare sends you your EOB or MSN, right? They send you those things. We want you to review them. If you see something unusual on one of those, the Shine counselor can help you get your money back, Medicare or Medicaid, Medigap. And we recommend you get a new card. Now, Medicare will not say, would you like a new card? You actually have to say, I'd like a new card. So get a new card. So this is just other things that we want you to be aware of when you're looking at your MSN. Make sure it's your name. Make sure you went to see that doctor. Make sure you're going to Ohio. And sometimes we get an X-ray here, but it's red out of state, right? So be careful there. And then make sure you got the right services. It's not an office visit, complicated visit when you're pre-existing patient. You're not a new patient. So this is us. We're Shine. It's a federal program. Federally, we're called SHIP, and in Florida, we're called Shine. I brought these little books here. If you'd like one, I left them on the table here. This is what we call a healthcare tracker, and this is helpful. Every time you go to the doctors, you write down what happened to you at the doctors. And you can say, oh, I had a lab work that day. I had a CT, I got my flu shot. And then later on, when you get your EOB or your MSN, you could double check what actually happened to you that day. So that's helping us help fraud and abuse. So you have any questions about open enrollment? Yes, Mary.
I do. Would you speak to us on the Advantage plans and what's the difference between an HMO and a PPO? And essentially, how do they work?
So your HMO, your health maintenance organization, or your PPO, provider, I can remember that, preferred provider organization, is a Part C. They call it C. It's a Medicare Advantage plan. So you choose those, and you choose one of those, and usually, your Part B is still taken out of that, right? And then the provider, your primary care physician, is your gatekeeper, right? He manages your care, and anytime you want to see a specialist, he makes sure that you see a specialist in the preferred provider, or we used to call it I worked for a company that did that. We called it the preferred delivery system, right? That's a nice way of saying it, right? Preferred delivery system. And we would tell Dr. Smith, we want you to use these 3 cardiologists, right? We want you to use these 3 endocrinologists. We want you to use this rheumatologist because, those were cost effective, right? Those were the doctors that we thought were cost effective, right? And those are the doctors that worked in the provider network. So you are mandated, pretty much to go see the doctors that the doctor provides, right? At PPO is a little different. Plus, you need a referral, right? When HMO, we all know you need a referral, right? Before you get to the doctors, and first thing you get to that doctor, the endocrinologist, that you have your referral. Oh no, the doctor sent it. Oh, we didn't get it, right? Sorry. come back later. We didn't get your referral. The PPO, you don't need a referral, right? It's pretty much. But they still want you to be in that preferred provider network and go along with what they say, as far as the preferred. And they want you to see that certain eye doctor, right? They want you to see the eye doctor that's maybe across town, not the one you really like, right? They want you to see the dentist that's across town, not the one that they'll give you the one-on-one in the special care that you need, right? And you really like that nice dentist that is there, and you don't feel like you're in a waiting room of 20 people just waiting to be seen, right? You want that special treatment that you're going to get when you see the dentist that you prefer to see. You have the eye doctors and vision and hearing aids. So now you're not going to get the hearing aid you want, that's for sure. You're going to get that hearing aid that Hear USA, right? You're going to get that guy. You're going to get whatever the doctor prefers. So that's, we like you to make choices that are best for your healthcare at Shine and the Department of Elder Affairs. We want our Floridians to live well and age well, and to take care of yourself.
Thank you. In the audience here, how many people have standard Medicare? Okay, good. How many people are on an Advantage plan? Okay, I know one of the things that's been happening is that employers have retirement packages, and what they've done is they've gone to the least costly method of providing those retirement packages, and that's the Advantage plan. And that may not always be the best alternative for you, okay? There are the Shine volunteers who are wonderful. When Bea and I were talking earlier, I was telling her about one of our residents who did some checking and found that it would cost about $400 a month for secondary insurance. And Bea told me that there are a lot more alternatives out there that could provide the service. So checking with Shine is a good thing to do. Same with the Medicare Advantage plan. I can only say the Advantage plans are owned by large insurance companies, okay, and they're private insurance companies. And what's the goal of any business? What would you say that again? Okay, to make money. Okay. So there is a lot of money to be made on medical insurance, particularly on these Medicare Advantage plans. And I'm going to use a word that's not going to be too popular, okay, in healthcare, but it's actually a rationing of healthcare. It's controlling your healthcare costs by making sort of arrangements with specific physicians, specific providers who are within the network. And what did you say now is value service? Oh, value-based care. Okay. Value-based care, sort of the insurance companies are running medicine. Okay, essentially is how I see that. I remember in the late 80s when we were looking at alternative plans, how can governments save money? The state of Oregon came up with a whole list of diagnoses and ages under its Medicaid program. And they were really, really castigated because it was seen as rationing healthcare. Okay, but a lot of that is going on right now, only it's marketed differently. In this wonderful article that is not the Wall Street Journal, there is a Wall Street Journal article that we printed for you, but it seems as though people in their last year of life typically switch from the Advantage plan to the standard Medicare because that's when their health needs increase. And, I'm not suggesting that any of you are in the last year of your life, but, I can only use myself as an example. And that is, I don't want an insurance company dictating to me what doctors I will see, what facilities I will use, or anything. So that's just my opinion. Um, so now I'd like to open it up to questions. Jane, come over here. Debbie, oh, B's going to run the mic.
And I'm going to be leaving my work insurance to pick either a Medigap plan or an Advantage plan, probably a Medigap plan. But my question was, if I decided that I wanted to go on an Advantage plan, and then I said, oh, I want to change my mind and go to a Medigap, and I have that grace period to change. But if I decide at a later date, I know this is going to sound confusing, go back to an Advantage plan, I can't change again. Is that true? Because what if my health is bad and then I have to be accepted to a Medigap plan? Is that correct?
You can go back as long as it's a 5-star plan. That's why all those plans want to be 5-star, right? Because if you're a 5-star plan, you can go back to, you can change 5-star plan to plan.
Even if I have a pre-existing condition?
Yes.
I was told differently.
The
Medigap.
Medigap, no, you can't change Medigaps. And if you come off the like different Medigaps are different, right? A to, I think it's M, and like Mary was saying, Debbie was saying, the F is no longer in Florida. But all Medigaps have to cover 4 things. 4 things: the co-pays for A, the co-pays for B, hospice, and 3 pints of blood. I don't know why, but that's how it works. And but the other ones have other options, right? Some you can get out of state, but you can only go back to the one you had before, Medigap. If you come out of a Medigap, you can only back to the same Medigap. But you want to go back from an HMO to Medigap back to the HMO in 1 year?
No, let's just say you're on a PPO
Mhm.
managed Advantage plan, and then you decide, I really want to have Medigap coverage, but it's been a long time. I can't just change.
No, only during open enrollment.
If I have pre-existing condition, though, a
Yes.
Medigap plan may not take me.
Right.
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 You could switch that part, give it to your parts, but be able to go to secondary.
Right, you cannot.
Right.
You might not
That's
be.
correct.
If it's right, it's a 6-month.
Right, that is
Right.
correct.
And you only learn those things when it happens to you, right? 6
So-
months.
It's
too late.
So summarize it. Go ahead. Oh, so that's why it doesn't make to be penny wise and
question.
pound foolish.
That's a very good question. So once you lose your Medigap,
You
you
can't go
lost it.
back.
You can't go back. It's a great question.
Jane, I would just suggest not just to save a few dollars and take that Advantage plan to go. If you can go to standard Medicare and a supplemental, it's the smartest thing you can do, because later in life, when you really need the care and you've got an Advantage plan, you're going to find you're losing out on a lot of care.
And not only that, if you're not enrolled in Medicare D because you don't take a lot of medications, and then all of a sudden you do take a lot of medications, there is a penalty that is applied for every month that you don't have a creditable program or an equivalent to what Medicare D would pay. John?
Okay, about 4 years ago, I think, my company switched over to an Aetna PPO plan. And I looked at it very carefully, and they covered all the specialists we went to. My wife was living at that time. All the specialists we went to were covered, and it appeared to be a very excellent plan. About 3 years ago, my wife entered Water's Edge and ultimately was there permanently. And it's hard to remember it, but I don't remember any unusual bills that I got from Water's Edge. I paid
Oh, I remember. I remember we had bills, Deb.
Yeah, but I
We
don't think
struggled collecting from for your wife's insurance. It was very, very difficult.
But,
I just
okay.
didn't tell you about it.
I didn't see any extra too. I paid for the
It took us
breakfast
a
and the
couple
lunch.
years
I'm
to
sorry?
actually collect one of the claims. It took a couple years.
You're kidding, really?
No. So just,
Wow.
Yeah, you didn't know about it, but we knew about it because it took several years for Debbie to collect from your insurance program.
Wow.
And again, when we look at Water's Edge and how it will financially support the program here at Sand Hill Cove, if there's a cash delay, if it's taking her several years to collect on service that was already provided, now what is that saying? But I remember, Don, that there were deductibles that you had to pay that you were always questioning, that I remember that.
Really significant. I mean,
Well, I remember having significant discussion about those insignificant, that's the thing, Don. Yeah, I have a memory like a trap.
all right.
And correct me if I'm wrong, Debbie, but we can't bill you until we finalize the claim with the insurance, which means if we're having this trouble collecting and then ultimately at the end of the day it's denied, it could be a year or two then before those charges get pushed onto you. And then all of a sudden you're 2 years down the road thinking this is resolved. And now you're getting a bill because it's taken us that long to go through the process with these insurances.
Do you guys negotiate with any of these PPO plans, Aetna, Humana?
We try. We do our best. We have also tried to get contracts. Right now, where it stands, they don't feel that we are large enough nor have enough people on the contracts to make it worth it for them to have us as a provider. And we keep going back and forth and revisiting it. And we have an organization that's what they specialize is in getting these contracts working on our behalf. So we are trying, but our hands are kind of tied. And then our negotiating power is also kind of limited when they know we can't or aren't going to say no to a person because they're our person as well. It makes it harder because they ultimately know it doesn't matter. They're going to take you. So whatever rate we give them at the end of the day, we have gone back. Sometimes we do get a little more, not often, but we will try.
Okay.
Sometimes we've had them come back and try to recoup money and we've gone back to them. We've sent them more files or we'll ask for a telephone clinical review to talk to them. And we've been able to get it to where they've changed their mind and not taken the money. So we do try that. It doesn't always work though. So.
Wait, one more thing. We have a Sand Hill Cove resident at Water's Edge right now that Michelle got the authorization for all of the days and they still are denying the claim, even though they put it in writing, approved.
They changed their mind.
Because ultimately, they want them to go to the facility that takes the insurance, right? Because then that's their ultimate goal, right?
Another question over here.
I'm kind of fuzzy on what happens for long-term care at Water's Edge. If I were to go there indefinitely, what kind of costs am I going to incur?
I can talk about that. So then we're not talking about using your Medicare anymore.
Right.
Okay, we're talking about your life care agreement.
Yes.
Remember, the first 90 days, you're still going to be paying as though you were in your apartment.
Right.
Okay, after that, you look at your contract and it would be, if say your husband's staying in the apartment, you're going there, it'd be the second person fee shifts over to Water's Edge. And that's your
Okay.
cost.
That's my total cost.
You're going to pay for 2 more meals because we feed you 3 meals a
Okay,
day there.
okay.
And then if you had medical supplies and then your pharmacy bill. Okay.
So there's no per day cost over and above what we are
No,
already
because you've
paying.
got the life care agreement with Sand Hill Cove.
Great. Okay. Next.
Pardon? Forever.
This,
No. Forever.
This may be taking it another step further. We happen to have long-term care insurance. And am I right in assuming that any additional costs that may be brought from Water's Edge, long-term, really long-term care. I think it's up to the individual to make the request, and the money comes back to the individual who in turn can pay you.
We will submit it to your long-term care insurance every month. You will receive the funds and you would then
Then-
pay the bill. Yep.
Thank you. And you find them to be difficult to deal with?
No.
Thank you.
But that's another ball of wax. Okay, that's not what we're here to discuss. We're, because a lot of people have difficulty in understanding their life care agreement until the time when they have to use it. Okay. It's a wonderful plan. Your life care agreement is a wonderful plan. However, when you have Medicare, we cannot use your life care agreement because we are obligated to charge Medicare for whatever your costs are. Okay, so you really can't mix the two. Okay. Are there any other questions back there, Jane?
Jane again? Well, you're a paying.
I know that you can't, you can't be biased, but in the state of Florida or in Martin County, is there a preferred Medigap plan?
Not that I'm making any recommendations, but the one that is the easiest to work with is AARP United Healthcare.
Okay.
What other question, Jane? Jane's just going into those, the beginning years.
The
of
golden
Medicare.
years?
The golden, oh yes, the golden years, right?
Here she is. No,
Because you do get conflicting information, because I have my private insurance with my employer right now, and it's United Healthcare, actually, a very high deductible, which is why I've got to make a change. But I have my Medicare A and B. I was always told that that would be your primary and Medicare A and B would be your secondary to make the difference up. I've been told that is no longer the case.
No,
It used to be like that.
not now, no more. Okay. I was faced with that same issue, that's why I wanted to leave my job related plan because it had a high deductible. Okay. So before I was not going to be paying for anything, I had to pay all of this money. Okay. So I opted to go for standard Medicare, which gives me Part A and Part B, and then a supplement because the way I looked at it, what I paid for the supplement would be less than what the deductible was on the insurance. Okay. So there's no free lunch. Okay. I just want to let everybody know that right now. There's no free lunch. And, and with Medicare, you know what you have. Okay. You know what you have. You have Part A coverage, which is hospital, skilled nursing. You have Part B coverage. And Part B coverage takes care of 80% of what your doctor's visit will be. And then when you have a secondary insurance, as long as it's with a G or others, then your insurance takes care of that. So you have no out of pocket. Okay. You have your drug plan, which you understand. There's no free lunch when it comes to drugs, okay? Because even the higher cost drugs on the Advantage plan, there is an out of pocket. So I like to be in charge of my own health care, okay? And that's why I selected that. I also selected that because in case I need to have rehab, guess where I'm coming? Water's Edge. Okay. Any other questions? Um, she's no.
Thank you. I currently have a PPO plan and I need to switch over to the Medicare.
Right.
What is the easiest way for me to proceed with it? Go online, start with a manual, call
You
somebody
can
up,
call a Shine volunteer,
call
Rick.
Shine and go
Yeah.
speak directly. I have already, yeah.
Call a Shine counselor.
Okay,
what's best for you. They compare.
all right. Okay, sounds good. Thank you.
It's really hard to do it online because it's, it's unknown territory to you. And, the Shine volunteers, we had some of them on site here last year, and they were very, very helpful. Yeah, very helpful.
I keep thinking about Part D. I was always under the impression that there was just one Part D, but it sounds like there are multiple plans in Part D. Could you talk a little bit to that?
Part D, like your Medigap, is private people, private companies doing that. I mean, they're overseen by Medicare, right? There's certain things they have to provide. But yes, you can compare and contrast those Part D. And some of them, I understand, are as low as $5. So we always recommend when you get on your A, if you're not working, get your A, your B, and your D all at one time, right? If you're not working, please, because like Mary said, they'll penalize you if you don't get your B and your D at a timely
And-
fashion.
And Gail's making a funny face. She doesn't believe that some are only $5. I know
Can you-
people who have Part D plans as little as $14, okay? Yeah,
Can you,
but they're not on a lot of medication. But they have the Part D plan so that they're not penalized by Medicare when they need to really have a serious plan.
so then during open season, they could switch to a different level D. Could you address the donut hole?
Oh my, I have like 3 slides on that. I don't want to go into it. The donut hole is the difference between 4660 and 7600, right? So Medicare pays for you pay for 5% and Medicare pays for 80% to the first 500. You pay up, your deductible is $505. I think it's going to stay the same for 24. And then it goes on, there's different scenarios, but till you get to 4660. And then between 4660 and 7600, that's the donut hole. It's very, I'm even confused. They actually, for 2025, when the Inflation Reduction Act, that IRA one, right now, that with this year, they had $35 for insulin. Next year, by 2026, you're going to have more coverage. This year for 2024, it eliminates the 5% co-insurance for Part D catastrophic coverage. That's what you're going to get for 2024. 2025, it's $2,000 out-of-pocket cap in Part D, the infection reduction, and other drug benefits. 26, you're going to get those 10 drugs, right? That they said, Eliquis, Jardiance, I don't remember all of them. I have a list. Huh? Well, that's what the act says, so we hope that's, they put it on paper.
Next thing, the next thing they have to do is find agreement to pass it.
Yeah, so we'll help. So hopefully that'll help. Yeah, your lisinopril and all those other things. They never do those. It's,
Well, like I said, Gail, there's no free lunch, okay?
even the HMOs consist of donut holes.
to take into consideration is that you're paying a monthly premium for that Part D. They're also taking money, if you have enough income, they're taking money from your Social Security towards that number as well. And then you have your copay on your meds. So if you don't go through this Part D catalog and find out who's covering what on what day, you're paying a gazillion dollars for these meds, and you have to be really, really careful with those Part D plans.
You want to be a Shine counselor? We could use you.
Okay, are there any more questions, ladies and gentlemen? Are you confused or did you learn something? Barbara has a question.
Would you go back to the, what's going to happen in 2024 with the $2,000 a month that seniors will have to pay, and that the expense beyond that is capped? That's my understanding of it.
Barbara, what were you thinking?
Yeah.
Yeah.
2025. 2024, this year
Oh,
coming up, it eliminates the 5% co-insurance for Part D catastrophic coverage when you're in the donut hole, right? Catastrophic coverage is when you're in the donut hole. 2025, it adds a 2,000 out of the pocket cap for Part D for the year.
That means if you pay $2,000 for your drugs, it's capped. That's it, no more.
That's all you're going to pay
You are not required to pay
in
2,000.
2025.
When you hit an out of pocket of $2,000, it's capped.
It's capped. So in 2025. And that's what we're expecting, as Mary said.
Are there any other questions? Oh, Jane, what now, love?
We cannot enroll you in Medicare. We cannot, but we help you. We can't compare them. We give you a plan comparison for your D and your Medigap, and then we give you the number. Here, call this one to enroll. We give you the number to enroll it in.
Okay, yes, Ty, the question over here.
Thank you. Do you happen to know the deductible for Part B next year, what the cost is yet?
I had it written down and didn't bring it on this paper. I can tell you Part A, the copay for the 21 through 100 went from 200 to 204. And I think the B went to, they went up.
Couple hundred, I think. I think
not
it went
quite.
up. It went up.
It went up, but not a lot, like $10, I think.
I know. That's good. Thank you. Thank you.
Okay, ladies and gentlemen, any further questions? Was this helpful? I need feedback. Was this helpful? Helpful? Okay. All right, thank you very much for your attention. You had wonderful questions, especially Jane. She's already gone. Oh, she is there? Well, you know, Jane, you got a lot of your questions
Where's my
answered.
shine brochure with my numbers to call?
What?
I can get started.
I'm going to call.